If you need to leave your baby with other people, even if that situation seems far in the future, it is definitely worth getting used to expressing your breast milk. This means that you will be able to leave your baby for a longer period than just a few hours in between feeds, an essential tool if you plan on going back to work in the early months with a new baby. To this end, introducing your baby to a bottle if you are breastfeeding is actually a good idea. It is not recommended you start expressing until you've established a good breastfeeding routine with your baby, possibly around the age of 6 weeks. Make sure all necessary equipment is sterilized properly and express some milk. Wait until your baby is hungry for a feed before trying to give him the bottle. If you put some of your breast milk on the teat, he will probably accept it. If you are having problems getting your baby to take the bottle as a breastfeeding mother, seek help from your health visitor. It is recommended that women express milk directly following a feed, in order that your breasts have time to replenish their supplies. You may find you have most milk in the morning and find that a good time to express, but you will obviously need to find out what suits you and your busy routine best. If you don't seem to have much milk in your breast after a feed, just try later. The essential thing is to relax and not worry too much, as your body will respond accordingly. If you're not going to be expressing milk frequently, you may want to express by hand, a cheaper yet sometimes slightly trickier method. Warm your breasts first by putting a warm flannel over them. Then massage them a little before you begin. This will make hand expressing a little easier. The idea is to stimulate your let-down reflex, the reflex that lets your body know it's time for your baby to feed and your milk to start flowing. If you're having difficulty, try thinking about your baby, or you can even try looking at some pictures of him. Next, try squeezing and releasing the areola behind the nipple. You should see milk appear on your nipples, which if you lean forward and continue to squeeze, will squirt out in jets. Use a sterile bottle or container to fill. Even if you manage only a little, you can always come back later and try a bit more. Do change breasts, especially if your flow seems slow on one side. It may be that one breast is carrying more milk. Little and often is the advice offered by the National Childbirth Trust, who recommend expressing every 3 hours for 10 minutes, aiming for a total of 6 to 8 sessions over 24 hours. If hand expressing doesn't appeal to you, or you are finding it difficult, you will most likely find that using an electric breast pump is the answer to your problems. These breast pumps have detailed instructions demonstrating how to assemble the parts and how to position the pump on your breast. It should not be painful if you are doing it properly, and it is important you read the equipment notes carefully. As it was in the beginning with first breastfeeding your baby, positioning is everything. Place the funnel of the breast pump over your breast with your nipple level and in the center. The suction will extract the milk from your breasts and collect it in the bottle attached. Some women will collect a lot of milk and others will only get a few milliliters. If you change sides when the milk flow slows down, you should collect as much as possible. Women often find their milk supply is at its greatest in the morning, so this will be a good time to express.